Bernie Dyme. I am the president and CEO and founder of Perspectives Ltd. We provide employee assistance programs, organizational behavior, and behavioral health. Why should organizations prioritize mental health? Because it makes sense, both from a humanistic point of view and also from a business point of view. We know that we've been focusing on physical health and medical issues for years at the neglect of behavioral health. And I think there are studies that now are confirming what we've already known, which is that there is an intricate link between the two. Most issues that are physical have something to do with behavioral health, and getting better on medical issues and physical issues also is related to mental health. So I think it really makes sense, and it also helps people in the organization to feel like they're a part of the organization. We spend most of our working days at work, and if we could just get people to talk about it a little more like they do with physical health, it would make sense. I always feel like the best thing we should be focusing on is not mental health, but mental health and wellness. Think about wellness programs physically, think about financial wellness. I think it's about time we start thinking about mental wellness, which is really even dealing with the precursors to mental illness or mental health issues. How do leaders destigmatize mental health conversations in the workplace? It begins with just having the conversations, baking them into the normal part of all conversations, talking about mental health moments, mental wellness moments in all kinds of meetings, having leadership in organizations, because it really has to come from the top down before it goes across horizontally, having them have conversations about what mental health is and why it's important and what we're doing to ensure that people have access to mental health. I think the other thing, if leaders feel comfortable doing it, there's nothing better than role modeling. So those leaders who can talk about issues they or their family members have had without spilling too much, but certainly giving a sense of, hey, I'm human too. I've had this, and here's what I've done. I've gotten some help for it. I think that goes a long way. It helps to bring people's fears down. I also think that what's important is to make sure that if you're talking about mental health and wellness, you're also providing the resources to support that. So if you don't have an EAP or you don't have good behavioral health coverage, then you're basically talking in an echo chamber, and people will see it for what it is, as just fraudulent, to be honest with you. So having those conversations, starting with leadership, bringing it down is important. And I also think doing mental health and mental wellness, psychological first aid is really important. Again, the concept of mental health first aid, similar to normal first aid, CPR is, hey, you don't have to be a doctor, you don't have to be a nurse, you don't have to be a medical professional to be able to know some basics on how to deal with your own and your comrades' or colleagues' mental health. And when can you intervene? How can you intervene? How do you have those conversations? And when do you and how do you find resources if somebody needs more than just a conversation? Mental health first aid, psychological first aid, the terms are interchangeable, are really to begin the conversation about how to help people in distress, emotional distress. And there's actually 4 objectives to it. One is to provide guidance to both managers and employees. The other is to teach skills, teaching skills about how to have those conversations, what to look for, when to ask for help, where to go for help, how to provide resources, active listening, being non-judgmental and empathic. The other piece of it is it's about reducing stigma. So that's the 3rd major objective, is to reduce stigma. And again, the last is to really discuss resources. And again, I'm obviously biased, but I think EAP is a good hub for people to go. But it's really about, if you think about the other thing is, I should say what it's not. It is not about learning to be a psychologist or a social worker or a diagnostician. We are not teaching people to be diagnosticians, just like when you do CPR, you don't teach people how to do surgery. You don't teach people how to do tracheotomies. You really, this is about teaching them entry-level assessment and responsiveness and active listening skills. And really, it's also about teaching all levels of employees to sort of voice hope and courage, and do it in a way that is real, not false promises or not Pollyanna-ish. And it's something that we all learn to do anyway when we learn to be engaging. And that's really what it is how do you engage somebody who is in pain or distress? Listen to them non-judgmentally, be empathic, and try and provide them with assistance that they need. And sometimes that assistance is merely just being there, not doing anything, being there, making it safe and okay for them to not be okay. So I want to call your attention to what you may already know, and that is that May is Mental Health Awareness Month. I would love this May for us to see it as a jumping off point, not the end of the discussion, but the jumping off point for the next 11 months, a call I have for action for all of you out there, especially business leaders, is to develop a plan and implement that plan so that when May of 2023 comes, you're able to not only talk about that month again, but you're able to say, hey, look at what we've done in the year to make mental health awareness really mean something and have an impact.